cell anemia is an inherited disorder characterized by chronic anemia due to constant hemolysis. It's due to constant breakdown of red blood cells, abnormal red blood cells. Now, sickle cell anemia is not contracted, it is inherited. So it's passed on from affected parents to their offsprings. And what happened is this: the red blood cells have a very vital component known as the hemoglobin. And the hemoglobin is affected because it has a tendency to sickle. Okay, so when this hemoglobin is passed on, this abnormal hemoglobin that have the tendency to sickle is passed on from an affected parent to the offspring. Okay, the offspring develops or manifests with the disorder. Now, because the abnormal hemoglobin have lost that capacity to deform while passing through a blood vessel, unlike the normal hemoglobin that can actually deform, because of course the blood vessels are very tiny. Okay, so when they are passing through the blood vessels, they deform themselves, pass through with ease, and come back to their normal shape, which is often rounded. For the affected individuals with this sickle cell anemia, what happens is this: the abnormal hemoglobin have lost that tendency to deform while passing through these blood vessels. Okay, so they sickle when they are exposed to extremes of stressful conditions. So when they sickle, okay, they cannot retain that ability to come back to the normal rounded structure of a normal hemoglobin, of course, because they are abnormal. So they become sickle. Okay, now we all know that hemoglobin carries out a very important function, and that function is to transport oxygen to various organs in the body, okay, to encourage adequate perfusion. In sickle cell anemia, okay, the hemoglobin loses that function, especially if the environment is not conducive. In the presence of a low oxygen tension, okay, the hemoglobin becomes sickle. And when it becomes sickle, it cannot carry out that function adequately. And when that happens, the individual is likely to become anemic. And again, because the hemoglobin is abnormal, the body recognizes that an abnormal component and then gets it destroyed. Okay, so these are what informs the manifestation of the disease in individuals that are affected. One of the symptoms of sickle cell anemia is pain, okay, at presentation, vaso-occlusive crisis. From the word vaso-occlusive, the vessels are occluded, okay, and then that manifests with pain. They also present with hemolytic crisis. That has to do with breakdown of these abnormal sickle cells. Their blood level is reduced drastically, and they may come down with features of anemic heart failure, which will include tachycardia, weakness, dizziness, breathlessness. Some of them also come down with what we know as severe sequestration crisis. One of the functions of the spleen is to filter abnormal cells in the body. So this spleen recognizes these sickled cells as abnormal cells and then pulls them into itself in the process of destroying them. Okay, so and this is common in children. So when this happens, they have this abdominal distension. Okay, the spleen is so large, and then they are also compromised hemodynamically. In sickle cell anemia, presentations can be acute and chronic. Okay, the acute presentations are what I mentioned earlier when I was talking about the vaso-occlusive crisis, the hemolytic crisis, sequestration crisis, and so on. Those are acute manifestations. Okay, then the chronic manifestations are manifestations that occur as a result of multi-organ damage, because sickle cell anemia is a chronic disease. So over time, a lot of organs are affected, like the kidneys, the liver, the heart, the bones. So they may come down with acute kidney injury or even chronic kidney injury. Most of the organs are affected by sickle cell anemia. So we refer to those ones as chronic manifestations. But these chronic manifestations can be prevented if these individuals, make themselves available for regular clinic follow-up, and they are compliant on their routine drugs. We have some routine medications for them, hematinics precisely, okay, that will help the bone marrow to produce blood continuously, because these individuals are constantly hemolyzing, they are constantly breaking down their blood.